This is an 86-year-old female. She's here for right shoulder pain roughly for about 2 months. No injury. Pain with flexion and abduction. She has fairly good motion, but today seems like she only has about maybe 100 degrees of abduction. So we're going to go ahead and do an ultrasound. We're considering injection therapy. Can you slip out of this? Get your arm up. So I want to goo up your bra strap.
So we're going to focus on this patient that has significant biceps tendinosis and also some interstitial tears and splits within the proximal biceps tendon. Here you can see the biceps tendon attaching over the superior labrum. And here is this tendinotic tendon. You can see how it's swollen. There's also little splits that go through this tendon, which you can appreciate more in an axial view of the tendon. Here's this thickened tendinotic supraspinatus tendon with a partial distal articular surface tear. Here we just remove the biceps and we can get a little better view of this partial articular surface tear of the supraspinatus, and here's the biceps back in view.
So here, left side of the screen is medial. It almost looks like the biceps tendon is a little bit sublux. It should be sitting in a groove, which is right here. Almost looks like it's kind of going over that lesser tuberosity. Also, she does have some fluid around the biceps tendon as well, consistent with some tenosynovitis.
So here you can see the biceps tendon sitting over the lesser tuberosity. You can appreciate some fluid around the biceps tendon as well. And again, here's this very large sublux biceps tendon with some partial tearing and splits within it, which you can see here, kind of splitting it in a 1/3 to 2/3 ratio. Correlate with this with our MRI as well.
Wow. All this is like 3 or 4 times bigger than you would expect. Question is that tendon, or is there some loose bodies in there? We're 758. She's got her pec major tendon.
And here you can see the pec major tendon. Underneath that, you have the biceps tendon, which again has the split in it.
Deltoid muscle, huge biceps.
Again, here's that tear, which is a little bit more apparent here in this view, and it kind of goes in 2 directions.
I think there's like a split in it also, but you could be folded. Maybe some loose bodies making it appear like a large biceps. Here we're at 8 o'clock. Right side of the screen is distal. So this is all biceps tendon.
Again, very thickened biceps tendon. It does have some fluid surrounding it as well, which you can appreciate here. And here's that fluid, a little bit more apparent.
We're at 8 o'clock still. Here we are just going proximally. You can see the proximal biceps, just again very thickened, extremely thickened.
And again, here's the biceps tendon in the interval between the supraspinatus and subscap tendon, and it's quite thickened.
Left side of the screen is medial. Fairly normal looking tendon here.
These are normal looking subscapularis tendon, perhaps actually a little bit thickened, but overall pretty normal looking tendon. You can see a little anisotropy proximally, and also a nice thick layer of hyaline cartilage over the humeral head. Here as you go towards its insertion, you can see some irregularity, the lesser tuberosity, but that doesn't have a very strong correlation with any significant subscap pathology.
Okay. So now we're going to look at it in a cross-section view on subscap tendon. Right side of the screen is kind of inferior. Just looking at that tendon.
So here we're looking at the subscap tendon in short axis. We can actually see the biceps tendon in a transverse view, which you would not expect in this orientation of the probe. However, at this point,
this huge biceps tendon though as you go up.
The biceps tendon is curving around as it's inserting above the glenoid, and therefore with the probe, even though it's sagittal, in this location you're going to see the biceps tendon in a
we are in the
cross-section.
interval, we're at 803. Just this huge looking biceps tendon. Now we're going to look at our supraspinatus tendon, right? That's kind of your main workhorse tendon. So your layers are kind of deltoid muscle. Kind of here's some like interface between the deltoid and the subdeltoid bursa with some fat in the like.
Here you can see this thickened biceps tendon, which marks the very anterior aspect of the supraspinatus tendon, and you can see this little tear at the very anterior distal aspect of the supraspinatus tendon.
The peribursal fat region.
Here again we're at the anterior aspect of the supraspinatus tendon as it inserts on the superior facet of the greater tuberosity. It's thickened and tendinotic. You can see this partial tear as well.
Here's also some fluid in the bursa.
And here's the subdeltoid bursa. I would call it an isoechoic bursitis, pretty mild.
A thickened kind of tendon. It looks like one of these kind of irritated tendinotic tendons.
I would have to say the tendinosis of her supraspinatus tendon is probably the most impressive thing here going on right now.
I'd say mild to moderate, probably more moderate. Looks like there's some pretty black. You see something that's black that doesn't go away when you manipulate the probe. Think of maybe like a little articular sided tear. So here we are again with the anterior supraspinatus tendon. We're at 806. Now we're going posterior.
Again, you can see this dark line going across the supraspinatus tendon, and I believe there may be more than one of these partial tears, but one of them seems a little bit more obvious than the other.
See some linear hypoechoic signal there in the tendon.
Now we're switching to a short axis view. And again, here's this biceps tendon.
Large biceps tendon is kind of blending in with things.
So we're looking at the supraspinatus tendon now in short axis. You can see these partial tears in cross section. Again, a thickened supraspinatus tendon consistent with tendinosis. Here's the MRI. This is a sagittal MRI showing this thickened supraspinatus tendon and also this partial tear, some increased signal in the tendon as well.
Right side of the screen is lateral.
Here's our infraspinatus tendon, which looks fairly normal. You can see it inserting on the posterior aspect of the middle facet.
So
also here in the MRI, you can appreciate an overhanging
see some of her
subdeltoid bursa.
infraspinatus attaching on the greater tuberosity. Now we're going to just look at it in short axis. The right side of the screen is inferior.
Here again, you can see the infraspinatus tendon on the left with teres minus tendon on the right. Usually it's a 2-to-1 ratio as far as size is concerned.
Go down
Infraspinatus being greater than
we have teres minor, then infraspinatus, and we're just going to follow those as they form a tendon.
You can see the two tendons merge as you go distal towards the greater tuberosity. And also you can appreciate this little divot which demarcates the two tendons.
Okay.
And again, here they are merging into one tendon essentially.
Okay, we're going to go ahead and do a subacromial cortisone injection. See my needle in the right corner, upper right corner?
Yeah. Oh, right.
A little shallow. I'm going to go a little bit down here.
So here your target is the subdeltoid bursa, which lies underneath the peribursal fat, which is that kind of thick, bright white line that's above the supraspinatus tendon. So you want to make sure to get below that, otherwise you'll probably be injecting the deltoid muscle. Here's the needle just skimming below that peribursal fat, above the supraspinatus tendon.
That's the trick. Sometimes you really have to play with your probe. Right now.
And here's our first little injectate, which you can see spreading distally.
So breaking through that bright line,
Yeah.
that's our peribursal fat. Bring over the tendon.
Now you can see how the injectate spreads nicely over the tendon, filling up that subdeltoid bursa.
Alright, we just did our shot. Let's see you move it up now. Good. Down. Okay, now go to the side.
This is the one that's I was going to say, but I won't say it.
How does it feel? Feel any better?
It feels better, but I still have a pain.
Okay, go up to the side. How high can you go? So you're better. Before you were only getting up to 90. Down. Now she's like 150. Go like that. Crank it out. Now reach behind your back.
This is the one that's toughy.
How does that feel now?
Yeah, it's better.
Okay. Well, about a month or so into an injection, right shoulder.
Yes.
For a subacromial cortisone injection. Ultrasound showed some significant tendinosis of the biceps tendon, as well as some tendinosis supraspinatus tendon, and maybe a partial tear of the rotator cuff of the supraspinatus. And how are we doing right now? We're about a month out.
I'm doing good. I mean, I can move my arm, you know. I could.
Let me see your motion. You want to stand up for me?
It's still sore when I do it.
Before she was
but
able to abduct to 100. Let's see what she can do now. Just go out to your side, all the way up. Good. So maybe 150, down. Go in front of you now, all the way up. That's good. Down. Go down. Go like that. Crank it out. No, put your hand on your side. Crank it out. Turn around now. Can you turn around for me? And now try to have your thumb reach up your back. How high can you go? No, the other.
This is the one, yeah, I can't go too.
Let's see your other hand. How much can you? So you're a little better. But overall, how much you feel like you're a lot better, a little bit better? Medium better?
As far as the pain goes, yes, I'm much better.
Okay.
But I'm still having, like in the morning when I get up, I'm still very stiff and it hurts.
But overall, you're doing a lot better.
But, oh yes, I'm doing a lot better.